Video 2. What exactly is diabetes and its types? Diabetes can strike anyone from any walk of life, and it does, in numbers that are dramatically increasing. Many people feel totally bewildered and confused when they have been diagnosed with a disease such as diabetes. While it is true that there is no cure for diabetes, it does not mean it has to be the end of the world. Learning about it can help you cope. So just what is diabetes? What are its types, and what can you do to better equip yourself to handle it properly and reduce any chance of severe complications? Let's find out. What is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the foods you eat. Insulin, a hormone made by your pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin, or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Blood glucose levels are higher than normal for individuals with diabetes.
What are the different types of diabetes?
Type 1 diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Type 2 diabetes. Type 2 diabetes occurs when the body does not produce enough insulin or when the cells are unable to use insulin properly, which is called insulin resistance. Type 2 diabetes is commonly called adult-onset diabetes, since it is diagnosed later in life, generally after the age of 45. It accounts for 90 to 95% of people with diabetes. In recent years, type 2 diabetes has been diagnosed in younger people, including children, more frequently than in the past. Gestational diabetes. Gestational diabetes occurs during pregnancy and affects about 18% of all pregnancies, according to the American Diabetes Association. Gestational diabetes usually goes away after pregnancy, but once you've had gestational diabetes, your chances are higher that it will happen in future pregnancies. In some women, pregnancy uncovers type 1 or type 2 diabetes, and these women will need to continue diabetes treatment after pregnancy. There seems to be a link between the tendency to have gestational diabetes and type 2 diabetes, and many women who had gestational diabetes developed type 2 diabetes later on. Gestational diabetes and type 2 diabetes both involve insulin resistance. Certain basic lifestyle changes may help prevent diabetes after gestational diabetes. What causes diabetes? Genetics, lifestyle, and environment can be causes of diabetes. Eating an unhealthy diet, being overweight or obese and not exercising enough may play a role in developing diabetes, particularly type 2 diabetes. Type 1 diabetes is caused by an autoimmune response. The body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. How does diabetes affect my body? Over time, high blood glucose leads to problems such as heart disease, strokes, kidney disease, eye problems, dental disease, nerve damage, and foot problems. How can I find out if I have diabetes? Sometimes a routine exam by an eye doctor or foot doctor will reveal diabetes. Diabetes affects the circulation to your feet and the tiny blood vessels in your eyes. If your eye doctor or your foot doctor suspects you have diabetes, they will recommend you see your regular physician for a blood sugar level test. The most common test is a fasting blood glucose test. After not eating for at least 8 hours, usually overnight, your doctor will take a blood sample. The normal non-diabetic range for fasting blood glucose is 70 to 110 milligrams. If your level is 126 milligrams or greater, you may have diabetes. Diabetes is a chronic disease that's present in individuals who are unable to use and store glucose in their bodies. Individuals who are diagnosed with diabetes need to see an endocrinologist or diabetologist at least once every 6 months and get appropriate treatment. Also, diabetes statistics up to 2021 show that individuals with the condition must learn how to monitor their blood sugar levels. Do not forget that uncontrolled diabetes may lead to serious health complications. Daily testing is important to make sure that the correct meal plan, exercise routine, and medication are all working optimally to keep blood sugar levels normal. Thank you for watching. See you in the next video lesson.